And I don't have any like real number for that, but we just, yeah.
I do. I
Yeah.
tore off my right quad tendon about 6 years ago. And the operating theater for one day with just the auxiliary staff, not the surgeon, was $44,000.
Oh my God.
The anesthesiologist was $2,800.
$2,800.
Yeah, and that still doesn't count the surgeon, because that was covered by my medical, well, it all was, but I didn't get separate bills for anything.
Okay. It's yours. Piping in with something.
Our experience was extreme in that our child was having her life saved by multiple people, but the bill for that was in the millions. So realistically, it does scale up. It does scale up, but it starts off really expensive. I mean, I think if you go and get if you're in the hospital and you get an ibuprofen and it's over 800 milligrams, it has to be prescribed to you, and that has like $1,000 ticket
Yeah.
price.
You just have to kind of, it's obscene, it's ridiculous. You have to either laugh or cry. I'm not sure which. In putting this material together, I was frequently extremely angry, and on various points in here, that anger will come back. So, you know that you're getting your insurance through your employer, you're feeling protected. You know that in a way you are, but in a way you're really not, because your employer is having to pay for all those costs. All those numbers we just mentioned, they're not being, if you're going to pay your employer, those are being, that's going into the premiums. You're not really being protected, because all the money you would be getting more money for your wages if the fringe benefit part of your benefits weren't having to be so high. So it's costing us all that's costing us money, in most cases indirectly, because most of us insured, except for one. Obviously, taxpayer-funded programs are coming right out of our taxes. And since 1929, healthcare spending in the United States has increased 5 times faster than the economy as a whole. That means it's 5 times more expensive to to get those services than it was at that time. And now some trillion-dollar numbers. I'm going to throw you 3 numbers. One is the annual federal budget, about $4 trillion. Remember, a trillion is 1,000 billion. And the national deficit, the national debt rather, is $20 trillion. So if we spent the federal budget entirely on paying off the debt, it would take 5 years to pay off the debt without spending on anything else. Now, so that's 4 and 20. How much would you guess is the unfunded liability for the federal share of healthcare? Unfunded liability, $70 trillion. That means that we'd have to, in addition to all those other unfunded things like the national debt, Social Security, and other things, we'd have to spend nothing on anything else for 17 and a half years in order to top up the obligations that this country has taken on in terms of healthcare. And that's according to the Congressional Budget Office itself. It's simply a number that nobody even pretends it's possible to pay. It's a train wreck that will happen at some point. But it's like many other things. It's this big picture thing that you can't tell what's going to happen, except that it's not sustainable. And in the meantime, it's impacting us with these costs. So I want to get at why these things cost so much. And some of the reasons can't be blamed on the government or anything, like there's demography, the fact that we're getting older. But that's going to increase, so this has exacerbated it greatly. We're going to keep getting older as a society until at least the year 2050. So it's not like we're already, lived through that stage. We're in the middle of that stage where the number of beneficiaries is increasing and the number of donators, the number of workers is shrinking. That trend is going to continue for a long time to come. But government is a major cause of these things. And another major factor in the rising healthcare costs is the third-party payment system, which is largely a government-related thing, but it has to do with how insurance and the government kind of work together. So, as you know, in a free market, supply and demand result in a price and a quantity that's being consumed. eventually, you find some kind of equilibrium. So government interventions distort the state equilibrium. And remember last meeting, we had Mr. Huddy here, and somebody asked him, when was the last time we had a free market in healthcare? And he ventured a guess. And what he said was, see, we were asking him those questions because he claimed to be, I guess he is, a past hospital administrator. So he would know, right? So somebody asked him, when, it's no longer a free market, when was the last time it was a free market? He said, oh, the 60s? Well, that's wrong, and I'll tell you that in a minute. Obviously, when the government reduces supply, and I'll give you examples of this, demand staying equal, price will go up. When the government increases demand, supply remaining equal, price will go up. And I'll give you examples of that. There's also price ceilings, price floors, and other types of government intervention, but I'm going to mostly focus on cost. And one kind of parable I will give to describe this is the pair of eyeglasses, where you go and buy yourself the pair of eyeglasses that you need for prescription. You're going to look for what you need with the best quality and the lowest price. You go to buy eyeglasses and the government's paying for it, you will shop for the quality, you're going to get what you want, but you don't care about the price. So half of the discipline is gone, half of the spending discipline is still there. Right? So you've lost half of the efficiency. But when you have somebody buying eyeglasses for somebody else, and the money's coming from yet somebody else, you've lost 100% of the discipline. And a way to put a number on this is that in 1960, 1/2 of the money that we spent on healthcare was out of pocket because insurance wasn't such a big thing then. Now it's 10%. So since the year 1960, we've gone 50% out of pocket to 10% out of pocket. Well, 10% is only 20% of 50%. That means we've lost 80% of our spending discipline. That's a way to look at it. And the prices have gone up proportionally to that. That's I think that's a very direct, proportionally cause and effect relationship. Now, providers, doctors, nurses, etc., hospitals, they've always had a conflict of interest in that they decide what treatments are necessary, and they get paid for providing those treatments. That's kind of a built-in thing. We don't blame the doctors for that per se. But when that factor gets combined with other factors, you have a very dysfunctional system. For example, MRI scanners. When it's been found that doctors that have an in-house MRI scanner are 3.2 times more likely to prescribe an MRI than doctors that don't have an MRI scanner, because it's a profit center for them. So the doctors, like everybody else, they're going to respond to the incentives before them. They don't have an MRI scanner in-house. They don't prescribe it unnecessarily, because why would they? But they have it in-house. Oh, they prescribe it. They prescribe it. Why do they prescribe it? Because they're getting paid without anybody asking any questions. There's no feedback. There's no accountability. There's somebody that's an open check, and they will prescribe the MRIs so as to keep their MRI scanner fully occupied.
I had read here something recently about private doctor's offices that own their own MRIs typically charge less than a quarter of what group health does for the same MRI scanner.
Mm-hmm. Yeah.
Because they're not getting funded by basically large insurance companies, they're doing it privately. The scans cost significantly less.
Yeah. We're going to get into that too. Yeah. Differential pricing. Healthcare services are largely discretionary. This part of the reason everything is so expensive is that a lot of this healthcare, a lot of times it's like a lot of the services that are provided are absolutely necessary. Many of them are absolutely unnecessary. A vast percentage of the services being provided are totally unnecessary. But then many are just in a gray area called discretionary. For example, how often should you see your cardiologist? Is it once a month or once every 10 years? You know, there's a whole spectrum there. How bad should you really get that elective surgery that somebody suggests, but another doctor says not to, and so forth. But since the providers are the ones that are recommending, and they're also the ones getting paid, they're the ones saying, yes, you need it, they push you towards it, they're giving you all, we're consuming too much. Why are we consuming too much? Because we're not paying out of our pocket. And governments, as we all know, they're technically illiterate. They intervene in the economy to produce a certain result, but then negative side effects crop up, so they intervene again to counteract those side effects, but they just cause more side effects. And the result, after all these years, is just mountains of regulation at the state and national levels. And all the special interest groups are feeding at the trough, and that's the vicious cycle that we're in. Compare that to retail healthcare services that are not part of any of that. They're running great, like LASIK surgery. The prices are stable or downward going all the time, and a variety of other things you can get that, and this evidently is happening more in some places, that there's something called retail medical care that manages to find little ways to do things that aren't all bound up by the regulations and the subsidies and everything, and those things are working. My wife and I are, well, my wife is going to be going to Manette Healthcare Clinic, which is in Manette, and that is something called concierge medicine or primary care medicine, which doesn't involve insurance. So the industry is trying to find ways to become functional again, and there's some hope there, maybe, but it's really screwed up. Okay, now we're going to do, any questions at this point? I want to do a chronology of why it's so expensive. So the healthcare system didn't become non-free in the 1960s. The healthcare system stopped being a free market in 1821. 1821 is when the university-trained doctors managed to boot out the doctors who had gotten their learning through the apprenticeship system. Doctors were originally learned what they learned through the apprenticeship system, and in that year, they were no longer allowed to practice medicine. And these are just some high points. In 1910, the educational options for doctors were further restricted, and everybody had to, like the osteopathy schools were closed, and myself was aware of this when I was a teenager, because I had two really smart cousins. They were both 4.0 students, but they couldn't get into the medical school because the admittance policies of the medical school is very restrictive, so that the people who already have their degrees, their supply is lower, therefore they get paid more. And so it's intentionally restrictive so as to make doctors earn a lot of money. The Food and Drug Administration was established in 1927. Any idea how much it costs on average to get a new drug approved?
Today or then?
Now.
1 billion.
Yeah, that's a good round number. Okay, that's a lot of money.
12 years.
Yeah,
Approximately 12 years or $1 billion?
yeah. So why do drugs cost so much? Okay, that's a large reason, I think. Now in World War II, a lot of things started changing. The government started to change its the way people pay taxes, in the sense that there was there were wage controls, but there were no controls, and they decided not to have any controls over fringe benefits. And so the employers who were bidding for employees to supply the war industry, they just started giving really good benefits. And they said, well, okay, we're going to make insurance for you that's really good. It gives you all sorts of, it's like from A to Z, and it's free to you. So that became kind of a habit for us. And now you all have employer provided seems normal to you, it seems natural. Actually, it's fairly recent. It started in the, like I say, about the World War II era. Prior to that, there wasn't so much healthcare insurance, or if there was, it was catastrophic in nature. But now it's everything, you know, from the routine checkup through the minor things as well as the major things. Another thing starting around the same time was Blue Cross and Blue Shield. What was new about Blue Cross and Blue Shield? Here again, those are paid with pre-tax dollars. Remember, if anything that you're paying with pre-tax dollars, and here, whether your insurance actually pays it or whether you actually pay it, doesn't really matter. If you're paying with pre-tax dollars, if you're in a 25% tax bracket, it's 25% cheap to you. That's actually a subsidy on the part of the government. It's a 25% subsidy if that's the tax bracket you're in. Well, Blue Cross and Blue Shield, they also had that tax exemption status, but they were given this other new twist that's been part of the problem now, which is that everybody is charged the same rate. This was a requirement for them to be in this tax exempt status. They have to charge everybody the same rate, called the community rate, and they can't turn down any pre-existing conditions. The pricing is one size fits all, and so it's good if you're that person who is, has a pre-existing, but it's bad for everybody else, And then in 1965, Medicare was established. This collectivized medicine for the most healthcare dependent segment of our society. And with that increased demand shot up there because all of a sudden everybody had all the people reaching 65 that had health insurance. Of course, it's good that they have this, but the price is that demand went through the roof and costs went through the roof. And it became difficult to even get a doctor. And in 1983, the government started controlling these skyrocketing Medicare costs by requiring pre-approvals and price maximums for various types of services. But the costs kept going up anyway. And so basically since those times, the system, speaking broadly, has been struggling like in a death struggle to try to figure out how to contain these costs. Everybody realizes it costs, too much. So they keep trying new accounting systems and they never work. Sometimes they say, well, you doctors and you hospitals, you can only charge this much, But then they say this is the price ceiling, but then that just causes a bottleneck of supply, and so you can't get your doctor's appointment. They don't have enough beds, and so there's no fixing it that way. That way it doesn't work because what the individual consumer has, all us consumers, the millions of us, we're millions of people who can find the right price and we can make the system work. But you have just a few planners who are supposedly going to try to make it. Well, they don't have the information. So it's the usual argument against central planning for people, In 1986, government passed the Emergency Medical Treatment and Active Labor Act. That's what involves the emergency rooms. Starting at that point, that's when the emergency rooms became the free clinic that everybody can go to because you don't have to pay. Even illegal aliens can go there. And so that's what started happening then. 2003, prescription drugs came along. It's a great deal, seemingly, for us, until we realize that we're paying in another way for it, because the government pays 90% of those free drugs for that are part of the Medicare program now. In 2010, Affordable Care Act was passed. More on that later. And this is, I've been emphasizing the federal government, but if anything, the states have intervened more in healthcare because most insurance regulations at the state level. And there's just no summarizing it. It's massive. All states have all sorts of regulations, stacks high, that's saying you have to provide this, you can't do this, your price is this. And so the insurance companies have to, they can't do anything on a national level. They have to do things on a state level or even on a county by county level. Your insurance programs are not portable from one place to another by and large. In fact, they're only good in this county. They have a different program in this county versus that county. So the whole market is balkanized down to little tiny pieces that can't be efficient in any one of them. Now, some, okay, now about that issue about differential pricing. So, there's something called the RAC rate, R-A-C-K, the RAC rate. Third-party payers, that's the insurance companies and Medicare. They negotiate with the hospitals and with the doctors. They say, we want a deep discount. And the more power that insurance company has, the bigger it is or whatever, the more strength it has. But then the hospital, if they have a lot of patients, they have a lot of strength too. So it's a matter of negotiating and bargaining. It's a real difficult, it's like kind of a combative, hardball industry, basically. And so the insurance companies are wanting deeper discounts. And the providers, obviously, they want to make money. So they say, okay, you can have a 20%, 30%, 40%, 50%. It can go down to like 80% discount. But then they just say, but the retail, the manufacturer's retail suggested price is, and then they just bump it up accordingly. See? So if it's like it can be 50%, well they've doubled it in order to come back to where they want. And that's the rack rate. Because if you don't have the insurance, you have to pay that exaggerated price. And that really pisses me off because there are people who don't have insurance. And if you get there's a lot of things that happen in insurance. You might have to pay something that you think is going to be covered, but it's not covered because it's a certain specialist at the hospital that's not part of the usual hospital thing. They're a contract instead of an employee of the hospital. Well, you get stuck with that bill, and it can kill you. But I would call that extremely dysfunctional, but I would not call that fraud. However, there's lots of fraud. Here's an example. Until recently, Medicare and Medicaid paid the pharmacists based on wholesale prices that they were supposedly paying for drugs. But those wholesale prices were all frauds. The nominal prices that the pharmacists were supposedly paying were inflated by several times, and everybody knew it, but the government just kept paying it. And the auditors would point this out. They would say to Medicare, you're getting ripped off. They're only paying this much, but they're saying they're paying this much. But, well, the legislators are, to a large extent, in the pocket of these lobbyists for the healthcare industries. So they specifically ignored it. In fact, they passed a law saying that system will be allowed to perpetuate as it is. They didn't want to have to only pay them the amount that they were going to be paying them. Because the lobbying, the campaign donations in this country, what's the number one industry that gives campaign donations to our congressmen? It's the healthcare industry. Bigger than defense, anything. The average congressman gets $175,000 a year, not just when they are running for election, that's average per year just from the healthcare industry. And then the American Medical Association, who you would not think of them as being critical of their own industry, but here they are kind of critical. They wrote in an article saying that 1/3 of the money that we spend as a country on healthcare is wasted. That's they themselves, the providers, admit that at least 1/3 is being wasted. If so, since healthcare is so much bigger than, say, defense, we're wasting more on defense than we're spending on healthcare. No, say that right. We're wasting more on healthcare than we are spending on defense. And the same article estimated that 30,000 Medicare patients die each year due to excessive drug treatments. Now, there's lots more. I read this one book that was just fraud after fraud. There was this one, it's in the ambulance system, the pharmacy system, the doctor system. They're making up patients. There was this one case where somebody tipped off an investigative journalist that they should go to a certain address and see what happens there. So they went there, and an ambulance showed up, but dropped somebody off. Ambulances don't usually drop people off. So the journalist went to the door and talked to the guy who had just gotten dropped off. He said, why did that ambulance just drop you off? He said, oh, well, see, he hadn't been informed not to, expose what was going on. He was just sort of uninformed. He said, well, they come and pick me up every day, and they take me to this building out works, and there's all these other people there, and they give us sandwiches and we watch TV, and the ambulances are coming and going. So it's just a whole fraud system. They're using their identities to run up bills to get paid. And this is not exceptional. These frauds are rampant. There's a whole book describing them all, you know? It's,
It's been about half an hour.
Can I ask what that article is you're reading?
I think you wrote it.
So,
this is
yeah,
my paper.
This is your
Yeah,
paper?
yeah.
Okay. I'm just curious.
it's just something that,
And I haven't read it, but I'll read it too.
Well, we can just break it here if you like.
Yeah.
There's a lot more material to pick up.
we can talk about it again next month, some more.
Okay,
Does anybody have any particular
anything else you wanna right now?
highlight?
It's, I heard this from someone that's been in the party since like 1980, Michael Wilson from Thurston County, and he's like, has a lot of knowledge. And he mentioned before that, and it just sounds so simple, but hospitals cannot be built where they want.
Yeah, they're
I mean,
monopolies.
it seems, what if, that was my forte, and that was, I'm really good at building hospitals, I'm
You can't
really
build
good
a
at
hospital.
administration, and hiring doctors, and doing things. You can't just make it happen.
Hospitals are monopolies. The Harrison Hospital has been the hospital for about 100 years, and in 100 years, I bet you it's still the only hospital. They're not allowed to fail, and no new ones are allowed to come in.
There you go,
In effect,
there you go.
one last.
I would like
Okay.